Welcome to the Banished Cancer Podcast. I'm Rachel, joined by James, the cancer wellness educator. Today, we're diving into one of the rarest and most aggressive blood cancers, acute myeloid dendritic cell leukemia. It's a mouthful, but more importantly, it's a disease that desperately needs new answers. James, let's start with the basics. What makes this leukemia so challenging?
Acute myeloid dendritic cell leukemia primarily affects older adults. More than half of patients are over 65. The 5-year survival rate for this group is below 10%. Traditional treatments like chemotherapy and stem cell transplants can be brutal with severe side effects. That's why researchers are looking at dendritic cell-based immunotherapy as a promising alternative.
Dendritic cells. Let's unpack that. What exactly are they?
Think of dendritic cells as the immune system's master coordinators. Their job is to capture foreign substances, process them, and present them to other immune cells, especially T cells. They bridge the innate and adaptive immune systems. When they're working well, they can trigger a powerful immune response.
And how does that translate into cancer treatment?
Dendritic cells can be collected from a patient's blood or bone marrow. Doctors isolate them using a process called leukapheresis. Once collected, scientists modify them in the lab to make them better at recognizing leukemia cells. These killer dendritic cells are then reintroduced into the patient. Once back in the body, they present leukemia-specific antigens to T cells, essentially waving a red flag that says "attack here." This activates cytotoxic T lymphocytes and natural killer cells to target and destroy leukemia cells.
So it's like training the immune system to see what it was missing.
Exactly. And because the therapy is targeted, it tends to cause fewer side effects than chemotherapy, which damages healthy cells along with cancer cells.
What do the results look like so far?
Clinical trials have shown encouraging outcomes. In one study, patients who relapsed after a transplant and received genetically modified dendritic cells had a 3-year survival rate of nearly 49%, compared to 27% in those who got standard donor lymphocyte infusions. Another trial using dendritic cell vaccines in relapsed AML patients confirmed both safety and efficacy. And when dendritic cell therapy was used after chemotherapy-induced remission, the complete remission rate hit 83% in patients with early relapse.
That's a big jump compared to traditional outcomes.
It is. Chemotherapy alone has long-term remission rates under 30%, and for patients over 65, it's even lower. Dendritic cell therapy offers a less toxic, more precise approach.
But it's not without challenges, right?
Correct. Leukemia cells are clever. They can suppress dendritic cells and evade detection. The tumor microenvironment often contains immunosuppressive cells that weaken the immune response. Logistically, producing dendritic cell therapy is complex. It requires multiple cell collections, precise timing, and strict tracking. And availability is still limited, especially for advanced cases where responses are often temporary.
So researchers are working on ways to overcome those hurdles.
Yes, advances in engineering are helping. Scientists can now generate dendritic cells from different sources, like CD34+ stem cells or monocytes, and even convert leukemia blasts into dendritic cells outside the body. Combination therapies are also showing promise. Pairing dendritic cell therapy with immune checkpoint inhibitors or chemotherapy can boost effectiveness. For example, WT1 mRNA electroporated dendritic cell vaccines have led to unexpectedly high remission rates in some studies.
That's fascinating. It sounds like the future is about integration, not replacing existing treatments, but enhancing them.
Exactly. Clinical trials are ongoing worldwide. Some are testing dendritic cell vaccines with specific peptides like WT1 or PR1. Others are combining dendritic cells with PD-1 blockade to overcome immune resistance. The results so far suggest that patients who mount strong immune responses to these vaccines often achieve longer remissions.
Let's bring this back to the patient perspective. What does this mean for someone diagnosed with acute myeloid dendritic cell leukemia today?
It means there's hope beyond the traditional playbook. While dendritic cell therapy isn't widely available yet, patients can ask their doctors about clinical trials. The therapy is generally well tolerated, with side effects limited to mild flu-like symptoms. And as research progresses, access should expand.
So the takeaway is that dendritic cell therapy is not science fiction. It's here, it's working in trials, and it could reshape how we treat this aggressive cancer.
That's right. It's a precision-based, immune-driven approach that could finally move the needle for patients who've had too few options for too long.
James, thank you for breaking this down. And to our listeners, remember, knowledge is power. If you or someone you love is facing acute myeloid dendritic cell leukemia, ask about emerging therapies and clinical trials. This has been the Banish Cancer Podcast. Until next time, stay informed and stay hopeful.